going to start with heart and blood vessels as promised. I'm going to be videotaping it. If any of you have any problems, please let me know. Any problems playing it or can't hear, I'd really like to hear your feedback. Hopefully this goes well. Let me know if it doesn't. We're going to be working on cardiac lecture. You could see it's heart and blood vessels. The way this will work is I have two screens. I have the whiteboard all drawn, and I also have the PowerPoints which will be projected just as this, and I can actually also zoom in on the PowerPoints. So if it's something really small, I'll zoom in so you could see the writing more efficiently. This will be the first screen that we'll be reviewing, heart and blood vessels. Okay. Cardiovascular system is going to be comprised of a couple different structures we're going to talk about. We're going to talk about the heart. Cardiac references the heart. We're also going to be talking about the vascular system, which references blood vessels. The two major groupings of blood vessels that we'll have are arteries and veins. Okay? Arteries are going to move blood away from the heart, arteries away. Veins will move blood towards the heart. The whole purpose of the cardiovascular system is to take the muscular pump of the heart to oxygenate the blood, conjoining with the lungs, and sending that oxygenated blood and also nutrient-rich blood out to the body. The body will use that and then send it back to the heart to start the cycle over again. Okay, so cardiovascular system to provide oxygen and nutrients to the body. Blood vessels. So once again, the series of blood vessels that we'll talk about are going to be arteries and veins. You can see from this picture, let me zoom in. This is how it moves through the body. You have heart. The heart will pump to arteries, which are the largest vessels. Arterioles are small arteries. Capillaries will be the smallest blood vessels that we'll talk about. Capillaries are important because this is where we're going to let oxygen out of the blood and bring carbon dioxide back. This is where substances can filter out into these tissues, and we could collect wastes to send back to be excreted from the body. Capillaries lead to venules, which are small veins. The veins lead right back to the heart. Okay, here we are with arteries again. Okay, so once again, arteries are going to carry blood away from the heart. They are very muscular and thick. When we do our dissection on the cat, or when we see the cadavers when we travel out to Seneca Falls, you'll see that the arteries are much thicker than the veins. Veins feel much floppier, and there's usually an artery and a vein right next to each other. Those arteries then will branch into arterioles and then capillaries. Okay, there are different layers of the arterial wall. If we zoom in, endothelium is going to be the innermost layer, endo meaning inside, of the blood vessels. That is made up of a simple squamous epithelium. Okay, once again, simple squamous is one cell layer thick. The endothelium is very important because it lines the inside of the heart and also the inside of blood vessels. Just outside of the endothelium, so if you imagine that the endothelium is the inside of the tube, around the next layer is smooth muscle, okay, surrounding that endothelium or those squamous cells. Smooth muscle will help to either constrict or dilate blood vessels. On the outside of that smooth muscle is connective tissue. That connective tissue actually helps to anchor vessels to those surrounding tissues. So if you can imagine, the endothelium will be on the inside, okay? Around that will be smooth muscle, and around that smooth muscle will be that connective tissue. So we have those concentric layers moving out of those blood vessels, okay? When that smooth muscle constricts or contracts, the blood vessels will become smaller. When it relaxes, it will open. Different areas of the body will need blood at different times, and that change in the smooth muscle will help to change where's the blood going at different times. They'll either constrict or they'll open if we need more blood. An aneurysm, okay? Aneurysm is going to be an expansile lesion of an artery. There are two main areas that this is very important to think about. In the aorta, and the aorta is going to be the main blood supply, comes off the heart, it comes down the center of the body, then it splits and it goes down to the legs, and it also says branches out to the arms. So this is going to be one of the biggest, most important arteries of the body, okay, the aorta. So we can get an aneurysm in the aorta. We can also get an aneurysm in the brain, which is very bad as well. What an aneurysm is if you can imagine the blood vessel being straight, and this is the way a normal blood vessel should be. With an aneurysm, that blood vessel gets weak. If you can imagine that straight blood vessel bulging out, and it rounds because there's a weakness right in this area, that is an aneurysm. That alone can be detrimental because of the fact that if that stretches enough and that blood vessel's tissues get weak enough from being stretched, we can actually have that burst. And if that aneurysm bursts, obviously that's a bad thing because blood will seep out. When you think about blood coming out of the heart, it's coming out at a high pressure. If you have an aneurysm in the aorta and it bursts, all that blood will seep into your body and it will be a quick death, unfortunately. Okay, so with an aneurysm, the endothelium, let me zoom in here, okay, the inside of the blood vessels become damaged. Blood can actually damage that inside lining. It can weaken the walls. If those walls get weak enough, it can burst. The two most common areas are in the aorta and the circle of Willis. Now, the circle of Willis is that blood supply to the brain. An aneurysm causes bulging and may blow, can cause massive internal bleeding, either in the abdominal region or in the brain. People can actually live with an aneurysm if it hasn't become too expansile. If it becomes too expansile, it becomes too weak. If it's slightly expansile and the walls of the blood vessels still have some integrity, a patient can live with that without it becoming a problem. But it'll be closely monitored. Some bread and butter stuff. The way it'll be monitored is by an ultrasound, okay? They can also do a CAT scan, of course, or an MRI if it becomes big enough. Okay, arterioles, once again, arteries, smaller arteries are arterioles. You could see 0.3 millimeters or less. There's going to be lower blood pressure because we're getting further away from the heart. They're going to lack that outer connective tissue. They have a thin layer of smooth muscle. These are the next step before capillaries. Okay, capillaries will then be beds of small blood vessels that will have with very thin walls a simple layer of squamous cells that will let the transfusion of gases across its walls into the tissue surrounding it to support and nourish them and give them oxygen, and also to pick up wastes to carry back to the heart to be excreted. Arterioles is the first step before that. Vasoconstriction, once again, we talked about smooth muscle. Vasoconstriction is the ability for a blood vessel to narrow. So if you imagine that this is the shape of a blood vessel, okay, that smooth muscle constricts, we have vasoconstriction. That smooth muscle relaxes and it opens, it's vasodilation. We'll do this in different areas according to where blood needs to flow or in response to cold or heat. If we want to give off more heat from our body, we would vasodilate the blood vessels near the surface of our body and give off that heat. If we're cold, we want to maintain the central core of our body and maintain that being warm. We would vasoconstrict the arteries going to our extremities and keep the blood in the center. That way we're keeping viable organs viable. So our heart can keep beating and our GI tract can keep functioning and all the organs stay safe. That's why people, when they go through periods of extreme cold, will get vasoconstriction in the peripheral regions and lose fingers and toes first, because our body starts to pull that blood back to the core of our body. Okay? Blood flow regulation is controlled by nerves, hormones, and temperature. Our hands get so cold in the winter because of that response to the cold. We bring blood back to the core. Capillaries is where blood is exchanged with the tissues. Okay, let's zoom in on this. We have a single layer of squamous cells that allow oxygen and water and solutes to cross, but not red blood cells. If you take a look at the picture to the right, you see a layer of simple squamous cells. That's the capillary. And the capillary, interestingly enough, is just about the width of a red blood cell. You see it passes right through. That way that red blood cell is right close to the edges and it can get rid of oxygen and gather up that carbon dioxide, okay? We can also let different solutes out. Our glucose, any nutrients can cross over as well, okay? Capillaries tend to be in bundles called capillary beds. And those capillary beds work together to supply that particular area of the body, wherever it may be in the hands, the arms, the feet, near the organs, that area with nutrients from the blood, and picks up all the wastes. Okay, lymphatic system. Lymphatic system is a series of vessels throughout the body that absorbs fluid, okay, that's not reabsorbed by the capillaries, picks up invading microorganisms, leads to a central collecting duct called the thoracic duct that drains the lymphatic drainage of the body, and it goes into what's called the left subclavian, sub meaning below clavicle vein, subclavian vein. The thing I want to talk to you about with the lymphatic system is when people don't have a good, strong, solid lymphatic system, they have difficulty returning fluids to their left subclavian to be excreted or processed by the body. We may have seen this with people who wear the support hose. If people have difficulty with drainage in their lymphatic system as a whole, but some patients may have it in one extremity or another extremity, or an arm per se, if there's a blockage in that lymphatic duct, they would put support hose on them, okay, to help to push that fluid back, okay. Veins. Veins are going to return blood back to the heart, has those 3 layers of tissue again. The endothelium, which lines the inside, a little bit of smooth muscle, and then around that's connective tissue. Okay, has a larger lumen or opening. Lumen is a different word for opening. They're a little bit flimsier than arteries. Arteries are pretty solid. Veins are a little bit flimsier. There's much less pressure than arteries, because if you think about it, we're moving away from the heart. As we get away from the heart, that pressure is going to decrease. This is an important clinical thing. It stores 2/3 of the body's blood. We tend to retain in this venous reserve about 75% of our oxygen. This is why the new theory about CPR is not to do mouth to mouth, to just keep doing chest compressions. If that patient still has 75% of their oxygen stores in their venous supply, in their veins, you could keep pumping it through their body and keep oxygenating their body and keep them hopefully alive until they could get help, okay? Because the blood pressure is much lower in the veins, okay? If we look at this last little section here on the PowerPoint, there are 3 mechanisms to return the venous blood, okay? So if the pressure is lower in veins, we need to be able to push the blood back to the heart. One of the simple ways that we do that is skeletal muscle contractions. I'm up and I'm moving and I'm lecturing to you and I'm moving my arms, and all those voluntary skeletal muscle contractions push the blood back to the heart. There are also one-way valves in the veins. This is not true of arteries. Arteries do not have veins, or valves, I'm sorry. Veins have valves, okay? And what those valves do is allow blood to go through but not backtrack. Finally, movements associated with breathing. Let me go back, okay? When we breathe, we actually change the pressure in our chest. And that changing of pressure helps to pull the blood back to the heart, okay? And pump the blood back to the heart. So breathing and skeletal muscle contractions and those one-way valves are going to help to return blood from the venous system back to the heart. We start this whole circuit over again, okay? Varicose veins are permanently swollen veins. You may have seen this with some people. It predominates as we get older or after children. Pregnant women tend to have difficulty with their veins because as the belly gets bigger, it pushes on the veins in the groin that don't permit the blood to return back. The blood pulls back in the legs, okay? And this could be with people who are heavier as well. Pulls back into the legs, it can stretch those veins out and you get those expand-style varicose veins. Can be treated with injections. They'll go in and inject that and shrink it, okay? Believe laser as well. And it can, of course, get worse with pregnancy. Support hose are definitely helpful for people who have varicose veins, or if you're up on your feet working a lot, support hose are very helpful as well. Okay, vitamins C, E, and selenium, don't cross your legs. The whole premise of returning the blood back, when you cross your legs, guess what you're doing? You're stopping that return of flow. It can increase the chance of you having varicose veins. Okay, the heart pumps the blood. So I'd like to talk to you about the different anatomical structures of the heart. This is going to be important for lab for us to know these different parts as well. Okay, so placement of the heart, we all know that the heart is on the left side of the body. Okay, it's going to be between the second rib and the fifth rib, approximately on that left side. Okay. If we're looking at this area of our chest in the center, this is the sternum. Let me zoom in. Okay, let me zoom in. I just want to point some things out. This area is the sternum. These two collarbones are the clavicles. So two of the lines that we'll need to talk about when we're talking about cardiac is going to be mid-sternal, which is going to be right down the center of that breastplate or breastbone, which is the sternum, and mid-clavicular. Mid-clavicular, if you think of this as being your entire collarbone, is halfway. Okay, mid-clavicular is on both sides, it's bilateral, and it's an imaginary line that runs down the chest plate that'll help us define different heart sounds as we talk about this in lecture. Okay, so looking back at this PowerPoint for the placement of the heart, left-sided between the second and the fifth rib, the sternum, mid-sternal line, and the heart is still on top of the diaphragm, all important landmarks. Okay, you can see the heart wedged between the two lungs. Okay, these are called the great vessels at the top here. Okay, the great vessels are going to be the aorta. And we're also going to have superior vena cava here and pulmonary trunk. We're going to go through all of these. I just want to give you a general overview. The heart is going to sit on top of the diaphragm with the lungs in the thoracic cavity. This area is also known as being mediastinal. Okay, the mediastinum is this central area with the heart and the great vessels. Okay, cardiac muscle. The cardiac muscle we've talked about in the past. If we take a quick peek, okay, microscopically speaking, if we were to look at the cells of cardiac muscle, just a little reminder here, they look like little Y-shaped cells. Okay. They have a central nucleus, and they have striations. Okay. So cardiac muscle, if you don't remember this, we did go over this at the beginning of the semester. Go ahead and pause the video, review it back in tissues, chapter 4. Okay, so cardiac muscle, when we look at it microscopically, it looks like a Y-shaped cell. This cardiac cell talks to two. Those two cardiac cells talk to 4, and it's exponential. They keep talking to more and more. What this does is it gives us a quick, efficient transmission of the signal through the heart muscle, because we need to do it quickly, right? How many beats per minute are we talking about? Okay, 60 to 100, constantly, every minute, every day, hopefully, of your whole life, right? So this exponential spreading of the electrical signal that makes the heart contract will make it happen quickly and efficiently, those 60 to 100 beats per minute. Okay, so pericardium is the muscle that helps that to happen. Okay, it's in the thorax, we talked about that. There are 3 layers. Epicardium is going to be the outermost layer of connective tissue. Myocardium is going to be that heart muscle that we talked about. Okay, endocardium is the inside lining. Endocardium is made up of a simple squamous, and this is continuous with that simple squamous on the inside of blood vessels. So it's sort of all through that cardiovascular system, from the heart to the arteries, to the capillaries, back up to the heart through the veins. Okay, the 4 chambers of the heart. This is a little picture that I wanted to show you. Let me bring in the camera. Okay. This is a great way to memorize the parts of the heart. Realize that when the heart grows embryologically, it starts as 2 chambers and it eventually turns into 4 and it twists. So it's hard to remember those structures because of that twisting, and also there's a lot of structures to remember. But if you make this simple chart, even though it doesn't look like the heart, it helps you to remember the blood flow through the heart, which will help you to remember all the different parts. And when we get into dissection, by knowing those parts and what flows into the next, it makes it easier to find those parts in the dissection in lab. So I start with the 4 chambers, written down just as this: right atrium, left atrium, so plural would be atria, right ventricle, left ventricle. Okay, ventricles would be plural. These 4 chambers are actually considered separate, considering the right to the left, because what happens is deoxygenated blood comes back to the right atrium, goes to the right ventricle. So this half of the heart has deoxygenated blood. It then goes out to the lungs. Okay? Gets its oxygen, comes back to the heart, enters into the left atrium. Now on this side, we're going to have oxygenated blood. Okay? So the right half of the heart is going to be deoxygenated. The left is going to be oxygenated. Okay? There's also different valves we'll talk about in just a minute. What I'd like to talk to you about next is how the vessels go to and leave the heart. What happens is we have 2 large veins, which are going to bring deoxygenated blood back to the right atrium. They're called superior, vena cava and inferior vena cava. These 2 basically are going to bring blood from the superior part of the body and the inferior part of the body. Okay? So they're going to bring blood into the right atrium. It passes through a valve called the tricuspid. Okay? The tricuspid has 3 valves, and it is considered atrioventricular because it's between the atrium and the ventricles. It will leave the right ventricle then by a structure called the pulmonary trunk. Okay. So we'll use this to represent the pulmonary trunk. Okay, the pulmonary trunk then leads to different vessels called the pulmonary arteries. Okay, pulmonary arteries then turn into capillaries that go around the alveoli in the respiratory system, okay, or in the lungs. So we have superior vena cava and inferior vena cava bringing deoxygenated blood to the right atrium, passing through the tricuspid valve to the right ventricle. It leaves by the pulmonary trunk, turns into pulmonary arteries. So the pulmonary trunk is one big vessel that divides into pulmonary arteries, which then get smaller and smaller and turn to capillaries. Those capillaries get oxygen from the alveoli, and then they start to head back to the heart. Okay? They're going to head back to the left atrium in vessels called pulmonary veins. Okay? There are actually 4 of them. Now we have nice, fresh, oxygenated blood coming back to the left atrium. Okay? It's going to pass through another atrioventricular valve called the bicuspid, okay, into the left ventricle. The left ventricle is a very important structure. The left ventricle is going to pump blood out of the heart into the entire body. Okay? It does that through the aorta. The aorta, once again, is going to be the primary artery that's going to supply the body with blood, okay? So superior inferior vena cava, right atrium, through the tricuspid valve to the right ventricle, leaves by the pulmonary trunk, goes to pulmonary arteries. Those go to capillaries that are in your alveoli. We get oxygen. We drop off carbon dioxide. The blood heads back to the heart. Heads back by pulmonary veins, which will go into the left atrium. We now have oxygenated blood passing through the bicuspid valve to the left ventricle, leaving by the aorta, which goes to the body. Okay. Now, the final two valves that we need to talk about are called semilunar valves, okay? Semilunar valves are going to be two valves, one found in the aorta, one found in the pulmonary trunk. They're called semilunar because they look like little half moons when you dissect them out. We'll look at them in lab, okay? So there's an aortic semilunar valve, and there's going to be a pulmonary semilunar valve. Okay, pulmonary semilunar, let me circle these. Okay, so pulmonary semilunar valve is going to be in the pulmonary trunk. Aortic semilunar valve is going to be in the aorta. Okay, we're going to go through all these structures in the notes. I just wanted to give you this chart. This chart's very helpful for both lecture and lab. Okay, so I would take a minute, look over this, make sure it makes sense, and now I'm going to progress through the rest of the notes, and we can reference this as need be. Okay, so looking back at the notes, so we've got the four chambers, the atria, top right and left. They have pectinate muscles that are inside them, which help with the contraction of the heart and also the placement of the valves. Okay, ventricles are on the bottom, right and left. They're more muscular because they need to pump blood out of the heart. The right ventricle is going to pump blood out to the lungs. The left ventricle is going to pump blood out to the body. This is an important one. Well, they're all important, but this is important because if this gets damaged or if we have a heart attack in this area, it stops pumping blood out to the body, which obviously can lead to death. Okay? And you can see that I put that little chart on this PowerPoint slide for you. The four valves prevent backflow. So we've got atrioventricular valves, which we talked about. They're between the atria and the ventricles. Okay? The right is tricuspid, because it has three valves. The left is bicuspid because you got it. It has two valves, okay? Bicuspid is also called mitral. You've probably heard that when we talk about mitral valve prolapse. Some people don't have a very strong mitral valve, and it can actually backflow a little bit, which isn't good because we want to keep blood flowing one way through the heart. If that valve backflows a little bit or falls back, blood can leak back and not get pushed forward, okay, in the heart. Semilunar valves, we talked about those. There's the pulmonary, okay, and the aortic. They're semilunar because they look like half moons. Exchanging gases. Okay, be still my heart. Know the lab. Okay, contraction happens due to innervation and connection between cells. When we're looking at cells, we've got those little Y-shaped cells. Okay, let me zoom in here again. Got those little Y-shaped cells when we're looking at cardiac muscle microscopically. Okay, here it is. And we know that one of these talks to two of those. Okay. Right? Okay. That connection between one and two cells, or between each of the cells, okay, this connection here, here, between these cells and the next cardiac cells are called intercalated discs. Okay, intercalated discs. These intercalated discs have gap junctions, and if you remember back to tissues, and if you don't, go back and look it up, gap junctions are the connections between cells that actually have an opening. They allow ions to pass through so we can have a muscular contraction going through the heart or the heart beating quickly and efficiently. So these intercalated discs are going to be the space that connects the two cells. The gap junctions are the openings in the intercalated discs that allow ions to pass through so there can be quick, efficient beating of the heart. When the heart beats, if it is beating efficiently and proficiently, it should have a whole contraction of the heart. What happens is the atria squeeze at top, push the blood down, and then the ventricles contract at the bottom. Whoosh, right? That lub-dub that we hear is a closing of the valves. Okay, so atria push blood through, and then ventricles push blood up and out. That lub-dub is the closing of the valves. Okay. Contraction occurs with myofibrils. Myofibrils we're going to talk about when we get into muscle next semester. Myofibrils are the small filaments that are in muscle which connect together to make muscles contract. Okay, so we'll get into that when we get into it next semester. It has lots of mitochondria. Can I ask you why? Why is that mitochondria? Mitochondria creates energy. Okay, mitochondria creates a lot of ATP. ATP, once again, is going to be our primary energy source. Okay, 60 to 100 beats per minute. Every day of your whole life needs a lot of energy. Okay, so lots of mitochondria to make ATP. Pulmonary circuit. I'm going to zoom in on the screen here, okay? If we look at this looks long. Take a deep breath and stay with me, okay? This is going to be the pathway of the pulmonary circuit. The whole premise with this is going to be bringing oxygenated blood from the lungs, okay, to the heart to be sent out to the body, okay? So we start with bringing deoxygenated blood into the heart. It goes to the right atrium, to the right ventricle, through that pulmonary semilunar valve. Get that little chart out that I just made for you. You could follow this. Through the pulmonary semilunar valve to the pulmonary trunk, to the pulmonary arteries, to the pulmonary capillaries, and this is where oxygen is added. Once oxygen is added, it leaves the pulmonary capillaries, goes to a pulmonary vein, returns back to the left atrium. Now the number is 24 to 8 millimeters per mercury. That is the pressure in the blood vessels in that pulmonary circuit. As you can see, it's going to be much lower than our systemic blood pressure because it's a shorter circuit. Okay, we don't have to push it through the whole body. If we look at the next slide, we're going to look at the systemic circuit. So we just talked about sending blood from the heart to the lungs to get oxygen, back to the heart to go to the body. Now we're going to talk about going from the heart to the body, back to the heart. Let me zoom in on this. Okay, so systemic circuit. This is longer and higher pressure, 120 over 80 millimeters per mercury. That probably sounds familiar. Those are our normal blood pressure values. Okay, so systemic is the body. So once again, you could pause the video, get your chart out. If we look at the left ventricle, okay, the left ventricle is the powerhouse that's going to pump blood to the whole body. It goes through the aortic semilunar valve to the aorta, which is the largest artery supplying blood to the body. Goes to arteries, those tiny arterioles, to the tiny capillaries, delivers the oxygen, gathers up carbon dioxide, heads back to venules, which are small veins, then the right atrium. Okay, we get this systemic circuit sending blood out through the whole body. Excuse me. Okay. Got to get the oxygen, got to send it out there. Okay, arteries and veins usually have similar names, okay, depending on where they're going. Radial artery, we all know this. I know we're just trying to learn these. Radial artery is where you take your pulse, okay? Radial artery is going to have a radial vein next to it, okay? Ulnar artery, ulnar vein, etc. Brachial, where we take blood pressure, brachial artery, brachial vein. Femoral, we know from femoral nerve, femoral artery, femoral vein. They tend to travel together, okay, except for some exclusions. Feeding the heart. Keep in mind, even though the heart has all this blood going through it all the time, it needs its own blood supply, okay? Those blood vessels or arteries are called coronary arteries, okay? So the external blood supply feeding the heart are the coronary arteries. Right where the aorta comes off the top of the heart, we have a right and a left coronary artery feeding, guess what? The right side of the heart and the left side of the heart. Okay, so coronary arteries are going to come off the aorta and feed the heart muscle itself. This is very important because when we start to talk about these coronary arteries and all their subsidiaries or the blood vessels that come off them, this is where we get what? Get blockages. If we get blockages, we can't get blood out to the heart muscle. If we can't get blood out to the heart muscle, we get what? Death. Death of that heart muscle is a myocardial, which means heart muscle, infarction, which means tissue death because of lack of oxygen. So this coronary or blood supply is going to be what gets blocked and leads to myocardial infarction or heart attacks. Okay? Cardiac veins will then collect all that blood that our heart muscle has used and send it back to the right atrium. Okay? Cardiac veins are going to feed it right back to the right atrium. Okay? Here we can see that coronary blood supply. I'm going to zoom in on the PowerPoint, or yes, on the PowerPoint. You could see the primary right coronary artery and the left coronary artery. You could see how both of them subdivide and branch around the whole heart and supply blood supply to the whole heart, okay? The two that we're going to focus on in this class are going to be right coronary. You could see that on the left of your screen, but the anatomical right of the heart. The left coronary coming off the aorta, okay? And anterior interventricular. I just want you to make a mental note of that, okay? Anterior interventricular, okay? Here is going to be the venous drainage of the heart. Okay, you could see that blue major vessel running horizontally across is going to be called what's called the coronary sinus. All those other veins that are draining into it, okay, bring all the blood back from the heart, drain it into the coronary sinus, and it leads right back to that right atrium. Then sends all of that deoxygenated blood that needs to be reoxygenated back to the right atrium. Okay, that's all we're going to do for today. I thank you so much. Please give me a response and let me know if you have troubles or concerns about this being uploaded online. I think this is going to be a great supplement for people. Once we get this up and running, I'm a little bit better at it. But let me know how it goes. Send me an email. Thanks. Have a great holiday. If I don't see you, travel safe. Take care.